We are back with Dr. Samantha Tross. Samantha, what kind of should, should I put it there? Mm, what kind of medical breakthroughs would you like to see in the future in your field?
I'm thinking,
Yeah.
um, well, it would be nice to see a cure. To me, a cure for cancer. Of course, that's not necessarily in my field, but of course, it involves. I get involved in that if there's reconstructive surgery required. It'd be nice to see a cure for arthritis, but then I was thinking to myself, that would put me out of business slightly. um, all right. Look, I'd like to have to make sure to see prostheses being developed that are guaranteed to have a prolonged lifespan. I mean, but that's happening. That's happening at the moment. I said some of the new prostheses are being manufactured. The results so far look excellent. So it'd be good to know that once one carries out an operation, that will see the patient through to the end, irrespective of the age at which the prosthesis is inserted.
Let me go to the chat room. I see some messages here.
Mhm.
Um, Give me a second. So Simpson asks, which area of surgery are you most comfortable?
I thoroughly enjoy hip surgery, particularly hip replacement surgery. I actually love that operation.
What is it about that but that specialty
Yes,
that appeals to you?
it's a more predictable outcome than knee replacement surgery.
Oh,
I think, yeah. So that's why I like it. You guarantee you do the hip replacement, patients get up within 3 to 4 days. I can get them moved. Some people can get patients home overnight. If you got a good backup service to someone to check in on the patient and adequate pain control, you can get the patients home much earlier than that.
so what is one of the most challenging knee surgery you had to do?
Knee surgery,
Yeah,
knee replacement,
or knee replacement.
revision knee replacement. If someone a revision is if someone's had a prosthesis inserted and it fails for some reason, whether it be infection, the prosthesis becomes loose, um, or a component of the prosthesis dislodges or whatever. Luckily, that's never happened to me. Dislodging of the prosthesis, but anything like that, and you have to then go in and do it again because the second time there's less bone to deal with. You've got to be careful when you remove the prosthesis not to damage the surrounding structures that are required to keep the knee stable afterwards. There are lots of challenges. Lots of challenges.
Hmm. And Simpson asks again, what are some common types of injuries you see in your field?
I have seen it all because remember, our field surgery has two aspects: the elective side and the trauma. And when someone is involved in a trauma, you can get anything coming through those. So I've had limbs that are practically amputated,
Oh,
hanging off by just a few, muscle fibers. I've seen that. To patients who have psychological issues and they implant foreign bodies into their skin, bone, or whatever. So you've got that side of things. To fractures, fractures around any aspect of the body.
a question I always wanted to ask surgeons, how do you manage to remain calm if you do, knowing from your experience that that person must be in a lot of pain?
Well, I think you've got to be able to behave calm, or else you're in the wrong specialty, because they're depending on you to be calm.
Mm.
So you can't. If you're someone who can't handle seeing blood or whatever, then that's not a specialty for you. And this is why I said when you choose a career, it's important to know yourself well. So no, I remain calm. I remain calm under pressure.
Mhm.
I think you have to if you're a surgeon.
Denise asked, what intrigues you about your field?
Because it's ever changing. It's exciting. I enjoy the use of the instruments that are required to perform the surgery. I like the variety. You've got young, old, male and female patients. So yes, those are the aspects. And as I mentioned before, the fact that there's a quick turnover, so you get quick feedback from patients. The
Hmm.
fact that most times I'm in bed in my bed at night. Um, These are the things.
I understand you teach as well.
I
So,
do.
what is it about teaching that appeals to you?
But it's very important that you educate the following generation because they're the ones who are going to be looking after me when I'm sick.
Hmm.
So it's very important that you give back and you encourage others to come up behind you. It's, as I said, these are the ones who will be looking after me. So I want to make sure they're trained well.
You are specialized, or you function in so many areas. The hip resurfacing, knee, and I hope I'm pronouncing this right. Arthroscopy. How you pronounce that?
Arthroscopy.
Arthroscopy,
Yeah.
computer navigated knee surgery, and so on. Tell me something. For those days when you don't feel like getting up, when you feel like maybe just relaxing for another couple of hours, who or what gets you out of that mindset?
Responsibility.
Mm,
I have a duty and a responsibility. I'm being paid to be there, so I have to turn up.
mm.
I'm not a morning person. I think that must have come across by now. I don't like leaving my bed. Um, but one has to. I mean, you have to get. And then, but once I get to work, it's like when you wake up, you feel tired. I don't want to get. But once I get to work, I'm excited because I enjoy what I do.
Is there a different Samantha
Hmm.
that walks into a surgical theater? Do there's some artists who say, well, when I get on stage, I transform, I become a whole different person.
Hmm.
Are there two different Samanthas? Samantha, the lay person, and Samantha, the surgeon?
Oh yes, oh yes. You don't mess with Samantha the surgeon.
Oh,
When I when I'm in the theater, but the thing is, these patients are depending on me to get things right.
uh-huh.
Everything must be done properly. I want to make sure that, and this is where the juniors sometimes they find it difficult to work for me, but everything must be done, and I'm there to check and make sure it's done. I'm very anal. I've got OCD when it comes to getting things right because that is how you prevent mistakes. You cannot prepare enough.
What
So
are some?
I'm very laid back most of the time outside of work and so on. But when I'm there and I'm
Uh-huh.
operating, everything has to be done correct.
What are some things you believe? And I guess that sense of purpose and seriousness are two things that come to mind. What are some things you believe that you are doing right that positions you to be a successful surgeon? And what do you believe being at the top of your game in the UK means or says about you?
Well, it says that I'm determined. It says that I'm driven. Um, yes, I mean those are two things. I think. Yeah.
What has been your greatest achievement or most meaningful moment as a surgeon?
Just achievement.
Too many, huh?
For me, it's from a patient coming in with a particular problem,
Uh-huh.
knowing that I've done my job well, and they've left the hospital happy. And I'm fortunate because of being anal. That happens frequently. Um, but, despite doing your best, sometimes things don't always go right. But the good thing is that if I have checked and put things in place to try and ensure that those things don't happen. The fact that you could document that you have given thought to the circumstance and what's happened is unexpected, then you'll be okay, both with the patient and both with the medical defense union. So it's important that you do everything as best you can, and you document well, and you communicate well with the patient. But generally, my outcomes are good, and that is because I pay attention to detail.
Are you at liberty to tell us what happens when a patient comes to you and you have to examine it? What happened? What's the process like from the time a patient or
Comes to see me?
hmm
Okay. Well, there are two aspects, as I said. There's the trauma, and then there's the elective side. So on the elective side, let's say a patient's come to me for a hip replacement. Generally, they would have been seen by the general practitioner who has decided that they need onward referral. In England, we have something called a musculoskeletal network, which is run by experienced physiotherapists and a GP or a physician of some kind, and then they will assess the patient and decide whether indeed the patient needs to come into hospital. And they would have decided that by examining the patient, seeing restriction in the joint, and also getting relevant investigations, which the most appropriate is an X-ray. And then when they've seen on the X-ray that there is arthritis, and the patient has limitation in activity, and they're not responding to painkillers, because not because you got arthritis means you need surgery. Yeah, so you've got to have pain at rest, uh, sleep affected, and your activities are not your pain is not controlled by non-surgical methods such as modification of activity, analgesia, use of walking stick, etc. So once they've decided the patient needs surgery, they'll be referred on to me. I'll see them in clinic. I will assess them, and I will then go through the risks of surgery. And then once they are happy to proceed and they're medically fit enough for me to proceed, we'll then go ahead for them to have a joint replacement.
In the chat room, Debro65 said, as a nuclear physician in Germany, it is interesting to hear you say that knee replacement isn't as predictable as hip replacement. I experienced this in imaging as well. Any concrete reason for this?
Well, I think the knees are more complex joint. You've got all the ligaments and the soft tissues that you have to balance in order to give adequate stability and function to the joint. Whereas with a hip, you've got to just place the components in such a way to stop it being unstable. You're not dependent on ligaments. Yes, the muscles give some form of dynamic stability, but it's not as intricate as a knee. And I think that's the main reason. You can put a prosthesis in a certain way, but if the soft tissues are not balanced, then the patient will not have a satisfactory outcome.
Looking back at your education and your approach to life, would you change anything if you had a chance?
I would worry less. I would worry less. I mean, there were times when I was studying, I was so fearful. I didn't think I'd get through the training at times. It hasn't been easy. Um, there was a period throughout the training when I actually was so tired from all the exams, and I wanted to give up. But I had one of my colleagues, my consultants, sit me down and talk me out of that. Then when I did my final surgical exam, on the first occasion, I wasn't successful. And, to me at the time, the exam was the biggest thing in life. Not passing it was, it was something like a fate almost worse than death. And the constant worry, am I good enough? Am I going to be able to do it? And perhaps not enjoying the journey along the way as much as I should have. So I would be, if I had to live it again, I would do it with the assurance that everything will work out.
If you could change one thing in your profession, what would it be?
I can change one thing in my profession. Hmm. Nothing springs to mind at the moment. I'd have to ponder on that one.
Okay, that's fine. Let's take a quick break.
All right.
We are back with Dr. Samantha Tross. Samantha, what is most gratifying about your profession?
To be able to make a difference.
To
To make a difference both to the patients and also because of my role as an educator, to make a difference to young students coming up, and to be lucky enough to be a role model to young women and those of color.
Kim asked, have you ever thought of going back to Guyana to offer advice in orthopedic surgery?
Oh yes, it's very interesting because um, throughout with the last government, a colleague of mine, a white male orthopedic surgeon, went to an international uh, conference in orthopedics where he was approached and asked to go back to Guyana and assist with developing a hip surgery program. So he came back from the meeting. He knew me, he knew I was Guyanese, and he knew I was a hip surgeon. So he thought I would be the ideal person. So you put me in touch. I won't call names with the individual concerned. And I went and I met with them and I offered my services and I was told my help was not required.
You
No help was required. So that was interesting.
wow.
However, I have, and it's something I want to do. Luckily, I was able to go over and go and assist with a, what do we call it? There was a program where they went out, a set of medical doctors went out to Lethema to assist with different specialties, an outreach program, and I was able to join in on that a few years ago, and it's something I'd like to do much more.
What was that experience like for you?
It was fantastic. I tell you something, I left there with the greatest respect for my colleagues in Guyana, and having gone to conferences in the Caribbean and seeing what other surgeons are doing in the Caribbean, I have the greatest respect for them. What they can achieve with the limited resources that they have is truly enormous.
Wow. And Kim asks, has any case ever caused you to doubt your ability to fix it?
There's any case? Oh
Hmm.
yes, oh yes, oh yes. I have been in situations where luckily this is where I say you say a silent prayer and you wonder, you say there must be somebody looking out for me. Where despite your careful planning, something unexpected happens.
Hmm.
A particular case came to mind as a patient whose bones were very, very soft. And it came in because of a fracture around a hip replacement. I was trying to revise it. And every time I tried to, the bone that was broken, attach it to the new device, the bone just kept breaking and breaking and breaking. And I thought, my goodness, am I ever going to get out of this operation? Um, so yes, they have been difficult and challenging times, and somehow or other, I managed to get through it. And I can only thank my lucky stars and say that there was someone looking out for me.
Samantha, you've received awards. Your accomplishments have been written and talked about in various forms of media. Many of us are extremely proud of you. How do you manage to stay grounded?
Because there's always more to achieve. So, I think that I'm not someone who gets, if you get caught up in the moment and think that, oh, you're so great and so on, then you somehow feel that you know it all and you don't progress. I think that I'm someone who feels there's always more to learn and there's always more to achieve. And for me, yes, okay, I might be the first female black surgeon. I would like to be known as the best surgeon. So I'm still working to get to the next level. I haven't got time to stop and dwell and get big headed about being at a certain position because I'm still trying to move on.
What do you do for fun?
What I do for fun, I enjoy eating.
Eating?
And luckily I've got good genes, so I haven't managed to pile on the pounds. I'm very grateful to my parents. I love to dance. I have done ballroom dancing in the past. I like salsa,
Ah,
and I enjoy traveling and just catching up with my friends when I can. Yeah.
and you're a Guyanese woman. Any particular dish you enjoy cooking?
But I didn't say I said I enjoy eating. I didn't say I cook. But nevertheless, I can cook. I can cook. What do I enjoy cooking? You see, for me, when I come home from a long day at work, it's to do something quick. So I'm probably going to grill something or grill some meat or fish and have that with some salad.
Uh-huh.
Now, at the weekend, I'll do something a bit more extensive. It may be, I love cook up. I love a good old Guyanese cook up. Particularly with this got salt beef inside.
Oh God, stop! I'm
Oh, yeah.
hungry.
And you have to make a bad pepper pot.
Oh really?
Oh, yes, yes. I don't only leave that for Christmas. Every now and again, I pull that one out. So, yes.
The girl could born.
Huh?
You could born, as they say in America.
I can burn. I can
Yeah.
burn. But I try different dishes. So I don't just stick with Guyanese dishes. I like different foods.
When are you most happy?
When am I most happy?
Mm-hmm.
I am most happy when I'm around friends and family.
Uh-huh.
I should put it in family and friends. My family will kill me for friends first before family.
You like traveling. If you had to pick a particular place, favorite place, and to go to relax with your favorite book, favorite drink, and favorite music, where would this place be? What would you be reading? What will you be drinking? And what music will you be listening to?
Right. Well, for me, anywhere hot will do very nicely. Thank you
Oh,
very much. Yeah. So I love being in the Caribbean. You know, there's something about just being back there. I mean, it's Guyana, anywhere in the Caribbean. I feel at home there. So I love being in Guyana. So it'd be Guyana, or my second favorite place actually is Trinidad. And
ah,
that's primarily because I've got lots of close friends there. So again, I think that comes in when I'm surrounded by people that I love. That makes me more relaxed. So it'd be one of those places. What would I be reading? Something very light. I tell you, when you're there working and reading medical journals, and I'm an associate editor for medical journal, and in my spare time, I don't want to have anything that makes me do any thinking. So it's going to be something very light. And I will be drinking a cocktail or
ah,
two or three. Um, I have a very sweet tooth, so I like my cocktails. I've never sort of gotten used to wine. There's a lot of wine in the UK when you go out. I like cocktails. And the music, I like a wide variety of music. My favorite singer, though, I do love Luther Vandross. I do love Luther
oh,
Vandross.
Luther.
Yeah.
Uh,
But you know, I'm a soul head, so you know, Stevie Wonder, Luther Vandross, um, Marvin Gaye, you name it. I mean, I enjoy music. I'll be that, or depending on the mood, some good old reggae,
oh
even
wow.
even raga. You can throw in the
What?
raga there, and my calypso. So you
Nice. Nice.
know,
What are you most proud of?
what am I most proud of? Oh, what am I most proud of? You mean about in my career and what?
Yes. Yes, I should have said that actually.
Yeah, I guess I'm proud. I am proud of myself. I'm proud that I've managed to achieve my goal that I set out to be was to become a consultant orthopedic surgeon, and I've achieved that, and I am proud.
Finish this sentence. I look forward to Sunday evenings too.
I look forward to Sunday evenings to relax before the hectic week starts.
Ah. What is a day in the life of Samantha Tross when she's not in the theater, when she's not tending to her patients, when she's not teaching? What is that like?
Well, recently I've just started. I've just taken up golf. That's my latest hobby. So, like for instance, let's say yesterday I wasn't working, so my day started off by going to the golf course and I had a lesson. I played around the golf. I came back. I had lunch with my mother, who's here visiting.
Ah,
We went out and did a bit of shopping with her. Came back in the evening, sat down, watched a film on TV, and you know, and relaxed. That's a day. And for me, that's a good day.
and what are you most thankful for?
I'm thankful for my health and to have a loving family around me.
Jill asked, what is a pet peeve in your profession?
Look, it's still a very male-dominated and in some aspects sexist. But I
Mm.
mean, you know that that's surgery for you. So that sometimes can be frustrating. But uh, I'm fine. I'm finding my way through. I'm finding my way through.
Angela asked, how do you get, wow, how do you get Kaz Reap and do you get the good one there? I guess she means in the UK.
No, I get my Kasri from Guyana, my dear.
Oh.
I get proper Pomeroon Kasri.
Oh, shucks. Proper Pomer. That's a tongue twister. Proper. Wait a minute, man. Proper Pomeroon.
Listen, I have my sources, my dear. So it's set over.
What?
Mind you, I have made pepper pot before with molasses,
What?
and it was not bad.
Uh,
So as a substitute, if one is desperate, you know.
not me. No, no.
No,
I'm
I
not.
know.
How you know not you if you never tried it?
I am not going down that road. Well, I tried it once.
You tried the
I
main
ha-
type of one with
I had
molasses.
it once. Somebody cooked it, and I said, no, no, something was really off here. Not molasses. No.
Tell
Um,
you,
proper power. Have we seen the best of Samantha?
Um, but who knows what the future has? No, I'd like to think there's still a lot more to be done and to be achieved. But I'm at a stage in my life now where I want to go into cruise control. You know, it's been struggle, fighting, and I've gotten to a position where I'm quite happy. And so yes, I want to get back to Guyana. I want to contribute. And I would love, my ideal scenario would be to get back, spending a few months a year, every year, working in Guyana and balancing the two work patterns. So if I could do that, that would be great. I would like to give more input.
If you could go back in time, what would
Mhm.
you tell 15-year-old Samantha?
I would say be kind to yourself, don't worry so much, and enjoy your life.
Mm. What would you like to be your legacy?
My legacy would be, well, obviously, I mean, the part of the legacy is what I've already achieved. The fact that I've made it as a consultant here in the UK, that's part of the legacy.
Yeah.
But I would like to say to people coming after me that believe in yourself, know yourself, and give up your best.
Mm. And what do you miss most about Guyana?
I miss the food. I miss I miss, you know, the thing about it. I miss having people like myself around. And this is why I feel so at home when I'm in the Caribbean. It doesn't even have to be Guyana. It's just to be among your people.
Yes.
That cultural identity. I miss that. I miss that.
Well, last two questions. Of all your dishes that you love to cook, or
Mm.
that you cook, pardon me, which is your favorite?
Of all, you know what? Is a particular favorite of mine, messaging.
Ah?
I love messaging.
Mm.
But the saddest thing is that as I've gotten older, I've developed a wheat intolerance. You have a a nice duff with your messaging. Why I tell you, this thing is this is painful for me, and I don't know what it is. Something they're putting in the wheat because I never had this problem before.
Mm.
But that's got to be one of my all-time favorite dishes there.
The Duff.
The duff in the metagy. I mean, can I love metagy without a duff?
Who would think? Who would think you love Duff? And last question I ask all my guests:
Uh-huh.
what makes you laugh out loud?
Something funny, so.
like, like, like proper Pomeroon. Oh my God,
Sometimes it could be the silliest thing, but as you just cracking up in stitches. So, but I'm
Samantha.
glad I made you laugh anyway.
Oh gosh, yes. Oh, you're. No one told me you were this funny. Nobody. You cracked me up. And so, thank you so much for spending this time with us.
It's been a pleasure, sir.
I know it's probably close to your bedtime. So,
Well, I'm a night owl. I'm a night
oh,
owl.
you're. Oh, okay. All right. Oh,
Yeah.
thank you. Thank you.
Take care, and all
You,
the best.
you too.
Take care.
Bye bye.
Bye-bye.